We've been talking with Justine for a while. She's done some previous presentations for us. She was formerly with the Housing Bureau for Seniors, so maybe some of you knew her from there. But now she does additional work, which she'll describe, and it's just such a joy to have her continue to be able to come to us and help educate us on things that we really need to know about. And when this presentation came out, there was a flurry of responses, so this is clearly something people have on their minds, Justine. So welcome, an honorary Presbyterian. We're glad to have you back.
Thank you very much, Reverend. Well, I'm very glad to be here. Thank you for your interest in this topic, the promises and challenges when choosing an assisted living residence. I retired from Michigan Medicine after a long career at the University of Michigan, where I primarily was focused in studying gerontology. That's how I became old. I was studying aging. It didn't save me from the years adding up. But I decided after retirement that I really could not stop. And I became focused in studying assisted living because really it's something that has emerged over the years, and it has changed a great deal. We find now that the average person is in their 80s. So they're coming to assisted living later in life with more chronic illnesses and requiring polypharmacy, many pills. So it's a much more vulnerable population than what it was in years past. Unfortunately, the state of Michigan has not kept up with protecting people the way it should, and this has been really part of my mission to educate you what to expect from the state of Michigan, where your protections are, and where you have to be your own advocate. And the only way you're going to know how to be your advocate is to know what to expect from the state and what your role is in it, and what your family members, how they can help you, or others that you might hire, like a geriatric care manager. So we're going to talk first about the promises of assisted living. You know, why move into an assisted living? Now, some people start out in independent living, but if you are starting out in independent living, you really should look ahead to what their assisted living is. The independent living will give you a feel for the culture, the policies for those who are independent, coming and going as they choose. Things change once you get into assisted living. But we go there because it offers some kind of a supportive lifestyle, home-like environment. If you've ever toured a nursing home, you know the difference in the look, the feel, and also the lifestyle. It provides a set of services for care, protection, and enrichment. You're also always going to be told about their activity program. You'll get a calendar. You may be invited to stop in an activity. You have an opportunity to stay connected to the wider community. You can come to your church. You can go to other civic kinds of things you enjoy, or go out to lunch with friends. You can come and go as you may. And you certainly hope to maximize your independence and control. We all do, right? We want to maximize our control. Well, you can maximize your control to the extent that you have the resources, and you have a support system, and you have some information so that you can make the decisions at the best time. And when is that best time? It's different for each and every one of us. And we hope that we're never going to have to move again. We know that moving takes a tremendous toll. Emotionally, it's costly. So we hope that, that is going to be, when we make that big decision, it's going to be a place we can remain. But let's talk about some of the challenges. Here in the state of Michigan, the term assisted living has no regulatory meaning. That's very different than other states. Other states define it. Dementia care is not defined. Memory care is not defined in the state of Michigan. There is not a requirement that the staff be trained, although they are expected to be competent. There can be involuntary discharge. Why? You're not paying your bills, so that financial planning is very important. Legal planning is all very important. We're not going to spend time on that, but you know, having all of those things in place is very important. Now, you can be voluntarily discharged if you hit the ceiling in terms of care they can no longer provide. So the levels of care are very important, and understanding those levels of care in any assisted living community that you would choose is important. You hit a two-person assist and they tell you, we don't have the staff for this, we can no longer care for you. So, you know, it's good to have clarification at the front end. Now, there's limited employee medication training, which poses risk. Now, all of us probably are on some medications, and depending upon the kind of medication that you're on, they pose more risk than others. Certainly, if you're on seizure medications or insulin medications, that poses higher risk than if you're taking some other things that aren't time sensitive, or if you got an overdose, wouldn't cause an unnecessary ER visit or hospitalization. Now, working conditions for those in an assisted living community, I'm not talking about the administrative layer, but I'm talking about the direct care workers, the people who are really going to be in contact with you for your care. There's low compensation, which impacts recruitment and retention. We'll talk more about that. So what can you expect when you go to an assisted living residence? Well, really, it's the same services you can get in your own home. You can bring in home care, right? But you make a choice for many reasons to go to a senior residence. Well, it's personal care, activities of daily living, eating, dressing, bathing, grooming, continence care. Again, the levels. Do you need an assist with a bath, a setup? Do you need a standby assist? Do you need total assistance? Those levels. Those levels of care are not standardized. They're different in each place. So you have to inquire about that. You have to find out their definition. This is jargon, instrumental activities of daily living, but you know, what kind of transportation would you be offered? Most places do have some kind of transportation. Meals. Meals are very important. We like to eat, right? We enjoy eating. And it's important if we feel like we can get a good meal. Well, what's the culture around dining? Do you sit at assigned tables? What kind of window do you have in terms of dining options? So all of those things make a difference in terms of our feeling at home, feeling like we have choice or control. You know, I should have asked you at the onset. Now, I know that all of you got that handout, the 6-page handout on comparing assisted living residences in Michigan, introductory guide with worksheets. This is hot off the press. I, along with another person, recently wrote this, and now you're going to look at this and you're going to say, 25 pages. I mean, where is she coming from? You think I'm going to sit down and read 25 pages? No, I really don't expect that. But it is a resource. It's a reference for you. And there are things that I know that I'm not going to read right away, and I just put them on my computer and I read them as necessary. And this is the sort of thing that you can do and download worksheets as you need them. And we'll talk more about that. But perhaps you haven't had a chance to peruse this, read it over, but it's there for you when you need it. So let's look at some of these other things in terms of instrumental ADLs. Managing medications, that's a big one. Now, assisted living communities are not medical facilities. rather social model. I would argue with that. I would say that they are a hybrid model. They're both social and medical. Anyone who's providing medication management steps into the world of healthcare. Now, they will say they're not in business for healthcare. And this is why they don't, in this state, provide certified people to administer medications. This industry has been successful in keeping that the way it is. And so, there are other things that, shopping and help with communication. Now, if you have hearing loss, if you have language issues, it's important to have people who can support you in communication. Now, let's look at Michigan's assisted living, the regulatory framework for Michigan. There are 3 types. There's licensed homes for the aged. Now, most of the homes for the aged, the senior residences in Michigan that are have homes for the aged are licensed. There are exceptions to that. They have exempt licensing. They got under the wire, and so they were able to get exempt. What does that mean? They don't have to follow any of the rules and regulations of the state. Now, one of the things that you got in this package, whether you have the 6-page or the 25-page, is a chart. And the chart is kind of a quick look at the types of assisted living. Now, homes for the aged are for those who are 55 plus, and they have to have a capacity of 21 or more. And they provide all these ADLs that I was talking about before. Now, the exempt ones, 55 plus, the same kind of services, but they're not required to disclose things the way the licensed ones are. The licensed ones have to disclose all their fees, their admission, and their discharge policies. They may disclose that, but they're not required to by the state. Also, they don't have the same inspections that the licensed homes for the aged do. They're inspected annually, whereas the exempt ones are only have an inspection with a complaint. And you have to put in a FOIA request, a Freedom of Information Act request, to find out what the problem was. So they make it pretty difficult. Now, there's licensed adult foster care, and that's for those that are 18 plus. So you might have people who are mentally ill, developmentally delayed, physically disabled, aged, or have a dementia. Now, you see here the owners. They can be individuals, private equity. Private equity is in all of healthcare. And, what are limited liability companies, REITs, real estate and trusts, corporations, and then the nonprofits. So what's the difference between the nonprofits and the for-profits? Well, the for-profits want to turn a profit. Who are they going to please? Their investors. And so when they are reinvesting, what are they reinvesting in? The nonprofits, they have to reinvest in their mission. So they may be making it better for their residents or for their staff. I want to be in a place where the staff are happy, where they're appreciated, where they're rewarded, where they can strive for something, that they can earn something, that they feel that they have a value. So that's important to find out. How do they appreciate their staff, reward their staff? Because certainly that has an impact on retention and turnover. So here's something that's very important for any licensed assisted living. They have to have a statement of purpose and eligibility. Now, this is all in your information. So they're required to have a written program statement, and that's the population that they serve and the services that they offer. Well, how do you find out about that? Well, maybe on their website, maybe in their brochure, maybe when you take a tour, but ask. It's written. They need to some highlights of the AFC and HFA shared rules. Now, the first one seems so obvious. They're only to admit residents that they can care for. Well, here's where we really have to applaud those that have the dignity to turn people away, and that's very hard on families. And that can happen with somebody who is diabetic, because and their medication is time sensitive. They may be able to tell you, we can't guarantee you that your family member is going to get their medication in that necessary window. You want to know that for any medication, if they can deliver it to you in any window that you may need. So this is the kind of thing you have to clarify. There may be devices that are needed, like lifts. Do they have lifts? Are the staff trained in using those lifts? Do they have the manuals in case something happens and it needs to be fixed? So not necessarily on your mind when you're going to visit, but over time, if you have the time, these are the things that you want to find out as you have more than one visit to decide if a place is the right place for you. They're supposed to have adequate staffing. Well, homes for the aged, it's at their discretion. There's no rule. Now, the adult foster care do have requirements that are regulated. And the large ones are for people have a capacity for 13 to 20 people. So they have to have one staff person for every 10 residents during the day. And then at night, it's 1 to 20. Now, who's the right person to be in a residence where there's one staff person for 20 residents? Are there people getting up in the night? How many people at the same time are getting up in the night? Now, this is a minimum requirement. They may have more, but that's something you'd want to find out depending upon the need. And things change over time, too. Somebody may begin not needing to get up during the night, but over time, if they're going to be staying there, that may change. So these things are important. They're required to have disclosures of admission and discharge policies and all fees. That's very important. There are a lot of regulations around discharging people. And there are violations also about discharging people, not giving them the adequate notice, which is a minimum of 30 days. It's good to know what those policies are. And there are required disclosures also for memory care. Now, in this packet, you didn't get the one on memory care if you got the 6-page one, but there is a whole section on memory care specialized units. As I mentioned, All Seasons and Silver Maples are just two examples of two assisted living who will tell you that they do minimal memory care support, and you have to find out how they define that. So it's just because a resident says that they provide memory care, each residence can define it in its own way. It is not regulated by the state in terms of what that means. So the highlights, again, they have to have a written assessment plan. So when you're admitted, you have in an adult foster care, a written assessment plan. In a home for the aged, they call it a service plan. It's to identify your specific needs. Again, those levels of care. Do you need standby assistance for a bath? Do you need total assistance? It's supposed to recognize the resident's preferences and competencies. So, for some people, they may need an assist with oral care. What kind of toothpaste do they use? Do they use dental floss? Do they use an electric toothbrush. All of those things should be documented. Because you want the person to be able to have continuity in terms of their health care needs, if it's oral care or foot care. There should be some continuity. So this is something that I really want to emphasize. With these assessment plans and with any kind of medication management, it's very important to be in touch with your doctor, to talk to them about your specific needs and the instructions that they would give. Now, they are required to get a health care appraisal from your physician, but many people have more than one doctor, right? Specialists, you have your primary, you have specialists, and those different doctors may have different instructions. Well, who's going to pull that together and communicate that and make sure it's in the plan? And again, things change. That plan is required to be reviewed annually, but things can change over a year. So it means that somebody has to keep abreast of those changes and make sure that they're getting updated. And things need time when you update, because it has to go to 3 shifts, right? Or however they schedule things. And they may not always be the same person. So you have to give things time to take place. Now, good news is that there's no restraints. That is a regulation in the state, whether it be by device, meds, or equipment. So that's a good thing. Now, there's the same direct care worker onboarding training, and you'll find out about that a little later, what that involves. And ongoing service training, continuing education. Now, think about this. I was in a work group for some legislative reform for assisted living, and one of the industry folks at the time, now this was 2 years ago, said that there were 3,800 adult foster cares in Michigan. Now, many of them are the small ones. And then you add to that the home for the aged, and there are hundreds of those, maybe 400 or 500. Now, each one of them make the decision about the training for their staff. No standardization across the state other than the onboarding. That is standardized. So these people who own the various adult foster care can come from any walk of life. So they have different credentials. They're not required to be certified. That's voluntary in the state.
What is onboarding?
Onboarding means when you first enter a job, the kind of training that they would give you to start out. Okay, so it's going to be kind of your foundation training. Yeah. Thank you. Okay, so who is this direct care worker, this person that you're going to depend on for your care? We know that there's that administrative level. There's the kitchen crew. There's the custodians. All kinds of people who have to make a residence run. But the people you're going to be coming in contact with a lot are the direct care workers. Now, this source is from the Paraprofessional Healthcare Institute. It's a national organization, and they really want to professionalize direct care workers and enhance their training. So let's look at the medium age here. You can see that mostly female, right? 72% U.S. citizens, 18% naturalized, 11% are not citizens, but it is up to the particular business to make sure that they meet the visa requirements. That's getting a little shaken up these days, and that's going to hit the healthcare big time. So look at the job openings. A lot of them, right? And they're across the spectrum, whether they're nursing homes, home care, or residential care. So let's look at Michigan's direct care workers. Now, this is based on data from 2023. So, 3 years old, right? And look at the earnings here. If you're working full-time in home care, residential care, and nursing home. Now here, in Michigan, 28% don't have access to affordable housing, so the hardships, the financial strain. 27% don't have food assistance. 31% have health or safety concerns. You know, you've seen the signs in every healthcare setting that you've gone, no abusive behavior. There's a reason for that. They get a lot of abuse. And it can be from the residents, you know, especially with dementia care. People do strike out, they can be dangerous. So that's part of their training, how to protect themselves and at the same time not abuse the resident. And you can see that the average turnover rate is pretty high in Michigan. So this is why it's so important to be at a residence where there's good compensation, that the staff is valued, and they're invested in. Now, let's do a comparison of training for certified nursing assistants in nursing homes and training for direct care workers in assisted living. Now, in nursing homes, and this is recent, they must pass a written and oral certification exam. They have to have 75 hours of education, including 16 hours of supervised clinical hours, and they're trained by RNs. They're not allowed to give injections, and they're not allowed to administer PRNs, medications as needed. So let's look at the training now for direct care workers. This is that onboarding training, first aid, CPR, infection control, resident rights. And I do suggest to you that you download the resident rights for both adult foster care and home for the aged. They are different. And that information is available for you. If you download the whole one, or you go to section H where it says residence rights, troubleshooting, advocacy, and making complaints. So there's quite a contrast here. So in assisted living, they are allowed to give injections, and they are allowed to administer PRNs. So again, you have to be in touch with your doctor to make sure that you know how this should be done the right way, and if they can match your needs. So there's some work and effort that goes into this.
By the family.
By the family, sure. By you, by the family, whoever your resource team is. They have to be a part of it. So this begs the question about, well, what if you're helping a person from another state come to Michigan, and you're not acquainted with their healthcare team? Well, it's important that if you are helping them make that transition, that you get familiar with those who are going to make any kind of a health appraisal. You need to, and this is you did get care needs, resident levels, and limitations of care. All of you got that as a part of your 6 pages. This is really the beginning. You know, sometimes we plan in a crisis, right? Things come up. And if that's the case, I would go to I would download that, because we have to know about care needs, and we have to know about medication needs, and we have to know about what things cost. So I would go to G, ownership contracts, payment fees, and costs. There are a number of costs. There can be upfront costs, you know, just to it be admitted. There are second person fees, there are pet fees. There could be extra fees for special diets, different level of care fees. Again, if you're in a licensed AFC or HFA, all of that is disclosed for you. But if you're putting together something quickly, and you know you need to add this up for planning, there's a way of getting this from looking at worksheet G. So let's look at some of the specific medication administration company standards that are required by the state of Michigan. So this is an actual regulation, I copied it down. Requires that all staff who administer medications be trained in the proper handling and administration of medications. So they're looking at their population and the residents, and they're saying they have to be trained in the proper handling and administration of medications. Well, what does that mean for you? I mean, and that's what you have to find out. They must be able to evaluate. Now, there are some people who can self-administer their own medications. Most of the people in assisted living don't, but there are some people who do. But that has to be reviewed over time. The ability to manage doses, timing, and recognize medication purposes. Now, this is recent from the state. As of the end of last year, they have this new training that's available. Staff members who complete a virtual training, then they do a post-training quiz, maybe a true and false quiz. I tried to find out the content of this. Believe me, as a taxpayer, I was really disappointed that I couldn't. So maybe I'd make a FOIA request to find out. Haven't had the time to do that yet, but so they have a post-training quiz, and then they have medication administration skills training and competency skills checklists, and then that will meet the requirements of an AFC administrative licensing rule. Now, this can be for the administrator, the licensee, or the direct care staff. Any one of them. So it's not required, it is offered. So you'd want to know, and this is in your materials under medication administration practices and staff competencies, worksheet F.
So that's not required?
It's not required. It's offered by the state. Now, they don't have to take what the state offers. They can go out and find their own sources for training. Yes, ma'am? Adult foster care. Yeah, okay. So adult foster care, AFC, Homes for the Aged, HFA. So this is offered. Now, here's for Homes for the Aged medication administration competency standards. The administrator or its designee are responsible for evaluating employee competencies. Well, what does that mean? I would ask, how do you evaluate your employees' competencies, and how are they going to be competent? If I have some special need, how are they going to be evaluated for meeting this special need? So you really have to make it about you when you look at these things. They must govern all administration practices ensuring reasonable safeness. Well, what does that mean? What's reasonable safeness? Vagueness, right? So what's reasonable for you? And this is where you have to communicate with your healthcare provider to know what is reasonable for you and set expectations. Can you meet these expectations? This is what I need to make sure that whatever medication or device that is being used is going to be safe for me. They're required to assess and monitor continued safety and ability to self-administer medications. And that's really a good thing, because things can change over time. If somebody develops a trauma, they may not be able to, get that pill in their mouth, or your eyesight changes. So there are a lot of reasons why that could change over time. So here, I'm going to take you to the statewide search for adult foster care in Homes for the Aged. This is supposed to work, and then you have help if I can't do it. Now, this is very important, and I would say this is a part of your due diligence ahead of time, and if you have time, please do. This is where you can find out about their renewal license and the homes for the aged have to renew their license every year. They're inspected every year. The adult foster care every 2 years. Their license is renewed and they are inspected every 2 years. So that's a big difference. So here, let's see if this is going to be nice to me. All right, so this is what you would see. Now, all of this is explained to you in H, worksheet H. You even have a picture in worksheet H how this looks. You don't have that now if you have the 6 pages, but just follow me for now. Okay, so here it's going to, with this drop-down box, you're going to find the facility type. And you can see here that it has the adult foster care large homes, the capacity of 13 to 20, the smaller ones 7 to 12, and the small group homes. Now we're going to look at home for the aged, okay? So that's right here, and you can see underneath that there's homes for the aged exempt. So you can find out in any county what the exempt ones are also. In this county, the evangelical homes assisted living is non-exempt. They're not a licensed assisted living. Their memory care is a licensed adult foster care. So you may go to them and they'll say, they don't have to disclose that to you, right? But you know who will disclose it to you? If you go to Story Point, they're going to tell you that they're not licensed at evangelical. So the news gets out. Okay, so we'll look there. A friend of mine had that experience with Story Point. They told her she was going to look at the evangelical and make sure that they knew that they were not licensed in their adult foster care. Okay, so you can see here all the counties, right? So you may decide you're going to go to another county. That's fine if you're not going to be in Washtenaw. You can find out any county here, but we're going to go to Washtenaw. Okay. So then I'm going to hit search. And what will pop up are all the homes, licensed homes for the aged in Washtenaw County. Now there are 10 on this page, and there are 4 on this page. So in Washtenaw County, we have 14 licensed homes for the aged. Now I'm going to look at one of them, just as an example. I'm going to choose University Living. I could choose any of them. And you can see here that it gives you information, very basic information, right? They serve people who are aged, and they advertise that they serve people with dementias. And here's their licensing information. Now, the owner and the licensee can be 2 different people. One of the things that I've been working on over the past few years has been some legislative initiatives called Teresa's Law, and one of the initiatives behind this legislation is to increase transparency. To find ownership can be pretty difficult, and that's not really fair to people. So let's look here, reports available. Now we're going to look at a special investigation report, which means they've had a violation. But I would encourage you to also look at the renewal of inspection reports. Yes, sir?
When the ownership changes, can they change what they've offered? Because if you signed up with Group A,
Right.
and you were very happy,
Yeah.
when they sell the Group B and B strikes out 50% of it, what are the recourses?
Yeah. Well, that's an interesting question. They certainly can make changes as new owners. I mean, they certainly have to stay within the regulatory limits. But let's say they can change their levels of care. They're not going to define it in the same way as the previous owner. And what are your choices? I don't know if you would be able to do something about that. So you may decide that you're going to stick with it because it's so hard to move, right? And find another place and get adjusted to another place and supplement perhaps what they're not offering. It puts you in a tough position is what it does. I don't know specifically what alternatives you would have legally that would make a difference. Yeah.
Well, you sign a contract.
Yeah.
With A.
Right.
When B takes over,
Yeah.
do you know if you have to sign a contract with them or they just?
Yeah. I don't know. That's a good question. I'll look into that, but I don't have an answer for you now. Yeah. You know what? Go to Gemini. I've been having fun with Gemini, but that may be a good question for Gemini to ask you. That's a really interesting question. Okay, so let's view this inspection report. So this means that they were inspected and they got a letter from the state to the administrator saying, things aren't right here. You have a problem and you have to fix it. You have 15 days to fix it. And we're writing you this letter to tell you you're out of compliance. So here there's the identifying information when the investigation began. And these are very thorough. So here's the allegation that the resident was over-medicated with Seroquel. And the violation was established. And there's another one. The family said they couldn't get the medical records. That violation wasn't established. So as a part of their investigation, they interview everybody who is concerned. The staff, the administrators, there could be outside people who could give them input. And the narrative is all here. And you can see how thorough it is. It's impressive. It really is impressive. It's unfortunate that they're in a violation, but the investigation that they do is quite thorough. So here's the conclusion, and it has the rule around medications, that the prescribed medication managed by the home shall be given, taken, or applied pursuant to labeling instructions, orders, and by the prescribing licensed healthcare professional. And here, the resident did not receive medications as prescribed. The facility did not have an explanation for the 6 days in August 2024 when the resident did not receive his prescribed medication. Further, the facility was not able to explain what steps had been taken by the facility when the resident ran out of medication later. So that's a big problem if somebody, especially a drug like that. That's a big problem that this person missed medications and the facility didn't have the inventory. So that is an example of what you can find out if you are reviewing special investigation reports. Now I'm going to stop here and open it up to any questions or comments you might have. Yes?
What happens if a person's on Medicaid? Can you repeat the question if they don't have the mic?
Sure.
Repeat the question.
What happens if somebody is on Medicaid? Medicaid is under a great deal of strain. We're going to have to see what happens in this state with Medicaid. There are the adult foster care will accept Medicaid, but how that's going to unfold with this big beautiful bill is and you have to know the terms and condition of your long-term care policy, and that can certainly help pay for your care costs. Yes, sir.
If you,
Charlie? Sorry, we're live streaming, so I have to do that to you.
if you have a long-term care policy, and it provides potentially more benefits than the place that you're staying, or you're looking at, will most of these facilities allow someone to come in that's not part of their staff? Because a long-term care policy may let you hire someone to supplement.
Yeah.
But will the facilities, are they required to let you exercise that right?
You ask tough questions. Okay, so you'd have to find out the terms and conditions of your long-term policy if they're going to allow that. And there is a way that you can negotiate with a home for the aged to bring in supplemental help. You know, perhaps that can be worked out, but that would be the kind of thing you'd want to find out ahead of time, right? How that would work together. As a matter of fact, because the evangelical home is not licensed, one of the things I did was I asked my long-term care insurance policy to look at what they offer and ask them, even though it isn't licensed, could it be applied there? And my long-term care insurance policy said yes. But you have to find out everybody's rules and how they're going to work together. Yeah. Mm-hmm.
Can you tell us what the costs are? That's very, very important as to
It is.
what the costs are.
Mm-hmm. You're right, the cost.
What details?
So there is a place where you can find out what the median is for your zip code. All right, so I knew that question was coming. So I looked up my zip code, which is 48108, which is probably pretty close to everybody's zip code. And the median cost for an assisted living was $7,000 a month. So that could be lower or it could be higher. And again, it's how you fit into those levels of care, and it's with those extra fees if you're bringing a pet. You know, okay, so the state does not structure fees. So every place you go into, it structures their own fees. So you have to be able to know what's in that bundle and what's going to be extra. A friend recently, within the last year, had 3 strokes, no family around, lives in her own home. We went to visit Brookhaven, which is not, it's independent living, but they have an on-site personal care service there where you can get personal care and meals and other services, but it is independent living. And, you know, she walked away after looking at the apartments and after thinking about the house that is 2 levels, where she has lived for over 50 years, and how she's going to downsize, right? We all have that downsizing problem into an apartment. So that's kind of the emotional toll that hits you when you start looking. And the reason she didn't like other places that she looked at was because they were a room. They were not an apartment. And at Brookhaven, they have apartments. And you can bring in any services you want. You don't have to use theirs. But her kids, and this is a part of the emotional toll, because, you family members have a way of pressuring you. And you won't believe this, but husbands and wives can have different opinions about the need for this. So there are different places. And, he's thinking about his fishing equipment and his shop and hobbies, where is all that going to go? My brother, he had a wonderful phrase in terms of describing when we try to move things on. It's like taking a cup of water out of the ocean. You have all this. So, you're dealing with a lot. So the more you can get ahead of that makes it easier. So that's part of it too, that preparation. It's not only finding out about an assisted living, and that's a job in itself, right? But it's preparing, paving the way, and how difficult that's going to be for you or others. Some of you have others as cushions. Other people don't. So, it all depends what your resource team is. Yeah, Ryan?
When, we know what our situation is today. We know what our situation is today when we start doing an investigation.
Right.
Chances are the need to make the move is going to be urgent. Something happens to us, So the research that you did may not apply to what your needs are if you have a stroke or whatever it may be.
Changes.
Yeah.
I see your point, because things do change. And when you are in a crisis, it's going to limit your options. But if you have done some work ahead of time and you've narrowed it, we probably have some idea if we're going to stay in this county or go elsewhere. So, or maybe you have, or you're divided about that because you're where your kids live. You may decide to go to another county, but at least look into it. Get familiar with it. Find out what some of their policies are, what their culture is. Go to some of those activities. Things are always going to change. It's a moving target. This is one of the arguments against buying into continuum of care communities because, the independent living may be swell, but, maybe their assisted living isn't so swell. And here you put down this large amount of money up front, and you have this contract. And by the way, any contract, I would highly suggest that you have a third pair of eyes on it, even an attorney, to look over it, so that you know what your options are. You know what you can get out of if you need to. One of the things they said at Brookhaven is that you can cancel your contract anytime. Yeah, we give you have to sign one for a year, but you can cancel it anytime. Some assisted living communities may offer that also, or they may say, okay, you have to give us a 30-day notice. You have to sign a year lease, but you give us a 30-day notice. We'll work with you. So these are the sorts of things you want to find out. Yes, ma'am.
We had, gonna go back there, and then Mary's been waiting, so.
Okay.
Dan, and then Mary. Just remember, you gotta have the talking stick.
All right.
So, is it my understanding, is this correct, that the nursing homes and adult foster care are covered by Medicaid?
No. Well, nursing homes, yes, will take, some will take Medicaid, and some adult foster care will take Medicaid.
But then the assisted living and independent living are not?
Independent living, I don't know of any independent living that would take Medicaid. And you have to ask them, a place that you go to, if they take long-term care, veterans benefits, Medicaid, you can ask ask all those questions.
But some of the assisted livings will take Medicaid?
Some of them will. Some of them will, yeah.
All right. Mary.
So,
Hold on.
you mentioned licensing, and I'm just wondering if there are any other groups that provide some sort of certification that a person could look for if they're certified by, I don't know what.
Well, the licensing is for the assisted living and nursing home is both federal and state. Now, to be a continuum of care community and have the status of a Glacier Hills or a Chelsea retirement community, they have the actual certification to be a long-term care facility, a continuum of care facility, okay? The evangelical home, technically, they don't have that certification. So there are those sorts of certifications, yes.
Who else? Okay, Bill Hires, and then I'll come to your side again. Step down, Bill.
I've been asked a resident in Glacier Hills about a patient advocate. Her family lives apart from here, and she's in doing her planning, has asked whether or not there is a patient advocate who could, monitor her care and interface with her family, but somebody she can turn to as often as she needed to kind of watch out for her.
Sure.
I wonder if there's people around or companies around that are doing patient advocacy.
There are geriatric care managers, and if you call Turner Senior Resource Center, they can give you a list of geriatric care managers. Those folks are available.
We have several we recommend here through the church
Okay.
as well. The parish nurses are very eager to talk to you about that.
Okay, all right. There you go.
I just wonder, can you run that list up again, the list that's on the screen? And what are those?
Okay.
uh,
You want the homes for the aged in Washtenaw County?
Yeah,
Okay.
well, it's that list right there, isn't it?
Well, I have to get to the county. Okay, so this is Washtenaw, okay? And then on page 2, there are 4 others. Okay, so that's pretty hard to read, right?
Atria Park, Brookdale West, Chelsea, Clarendale, which used to be Baltimore,
Right,
Hillside Terrace, their memory care, Linden Square, Story Point, Gilbert Residence.
okay, then,
We have members of our church in 3/4 of those
yeah.
places now
Mhm.
that are happy to talk with you about their experiences. University Living, Meadows at Silver Maples, the Manor, Glacier Hills, and Villa at Willow Place. Is
That's
that new?
relatively new, yeah. Mhm.
What is that list exactly? It's Washtenaw County, but what are the?
They're homes for the aged. That's, right. They're licensed homes for the aged. And it means that their population is 55 and older, and that they have a capacity for 21 people or more. And they provide 3 meals a day and all of the various personal care services that we talked about in terms of activities of daily living. Those are and meals. So they provide room and board and medication management.
What is American House listed as?
Well, you bring up a really interesting question. Because
American House is what she's asking about.
American House, all right, let's look here. We're going to go to exempt. Let's see, okay, all right. So here are the exempt homes for the aged. There are 5 in Washtenaw County, okay? American House is one of them. Now, I've always in the past thought about American House as only independent living with on-site personal care services, but they are an exempt home for the aged. And so it says here that they didn't change Belfour to Clarendale here, and I haven't been able to find out from Belfour what part of their assisted living, if it's the assisted living or the memory care, is exempt. I don't know which. So if you go there, tell them that you know that they are on the list of exempt. And what is exempt? What part of their services are exempt? Now, they're going to tell you, oh, our independent living. Well, of course, independent living doesn't have any licensing. So don't let them off the hook. Now, I'm talking, you are listed as a home for the aged in the state of Michigan as exempt. So is that your assisted living or your memory care? And here, Brecken Village, I've already talked to you about their assisted living. Chelsea, I haven't a lot of information about. I don't know what part of Chelsea Retirement Community is exempt. And Story Point, I haven't gotten their story on that either. But these, it's good to know this, right? That they pop up here and you know about it, you're sophisticated enough to know about it, and they have some explaining to do. You want to find out why are they on this list.
Your question?
The question of Medicaid came up. I can relate an experience we had with my mother. First thing we had to do was get her qualified to be accepted under Medicaid.
Yeah.
There are certain rules.
Right.
That,
Yeah.
you can have a home,
Right.
I don't know what they are now, because with my mother, it was 10 years ago. And then when it came to the nursing home, when we were doing it, my sister and I, we found that nursing homes have a certain ratio. They will accept Medicaid, but only one or two residents. And generally, if you are not already in a nursing home that accepts Medicaid, it's tough to come from the outside.
Right. Yeah.
Luckily, my mother was in a good place, a good home, and I owe that to my sister doing a lot of investigating. So the Medicaid thing opens up a lot of
Yeah.
issues.
Yeah, and a good place to go for counseling is Ageways, that is formerly the Area Agency on Aging 1B. Their new name is Ageways. And if you Google that, you'll get their telephone number, and that's their information and referral number. And sometimes they have counselors at the different senior centers, and they will talk to you about, insurance. If you have to renew your insurance annually, they'll talk to you about the different plans. But they can also talk to you about how to qualify for Medicaid. So that is a good source because it's a neutral source. They're not going to lead you because they're going to make some gain.
Where's that again?
It's called Ageways. It's a area agencies on aging are across the U.S. Okay, and they're in regions. In our region 1B, and it used to be called the Area Agency on Aging 1B, but that's a mouthful for people. So they changed it to Ageways, Ageways.
Is that one word?
It's one word, that's right. They have an information and referral service.
I feel like Billy Johnson in our church is a good recommendation, a person to talk to about that. I know they're watching online today. She worked for Area Agency on Aging, I believe, out of Toledo,
Okay.
Toledo area.
Yeah.
Justine, I feel like we've had members that went into a Medicaid situation, but they did it through the rehab. Like they started out in a rehab bed and then
Yeah.
it's like they jumped ahead of the line or something. Does that seem to happen in some cases?
I don't have enough experience with that side of things to tell you. When you're in a hospital, in a rehab facility, you're going to have a social worker work with you. And they will send you a list of nursing homes, that's right. They'll send you a list of assisted living also for any county. You can ask them. Yeah, and if you're interested in memory care, they will send you, you can go to the Alzheimer's Association and they will send you a list of memory care residences in the county. Yes.
So, I'm from Bay County,
Mhm.
so are the agencies similar in
Yes.
other counties?
You
So
would,
they'll be
you would have an
age-based?
area agency in Bay County also. Yeah. What I would do is just write in area agency on aging plus Bay County. Or you could just call up any area agency on aging and they'll give you the number for Bay County. So if you have a resource here at the church, maybe you have the telephone number, you can call up Turner Senior Resource Center, they can give you the Ageways number.
What about Commission on Aging?
It depends, the different commissions on aging provide different services, you know, that could be helpful. I'm not particularly acquainted with it in Bay County, but they could be a good resource. Yes.
Tell me the difference between a home for the aged and a nursing home, please.
Well, a nursing home is a medical facility, and an assisted living, like a home for the aged, is not a medical facility. They are there to provide personal care. You are a resident, you are not a patient. In a nursing home, you are a patient. And you can be in a nursing home for rehab, and that's maybe covered by Medicare or Medicaid, and it's a short stay. Or you can be in a nursing home for long-term care. That's totally different. And that's out of pocket, or long-term care insurance, or Medicaid. And so, you know, those are the big differences. And also, the nursing home is covered by the state and federal government, and unassisted living is only state regulated.
You go back to that first page again, I wasn't fast enough to get the picture.
Okay. What first page do you want?
That, of the,
Oh, the,
Washington
okay.
County.
okay. There you go. Yeah, there's four more. Okay, there you go. There's four more here.
Yeah.
Mhm. I want to encourage you, write your legislator, tell them that, you know, you want to see action on Teresa's law. What this is attempting to do is to increase transparency, but also training for those direct care workers who are not certified or are licensed. So with this, they would be required to have annual training. So this is something that I would really encourage you to reach out and tell your legislator that things need to be better in the state of Michigan. You're not taking care of us the way other states take care of their older adults. This would, you know, the more voices, the better.
What's the name again?
This is Teresa's Law. The bill number may change because it's getting new support. The representatives that are behind it are Representative Wozniak, a Republican, and I don't know what district he's out of, and Representative Young out of a district in Detroit. But they are the two that are carrying, well, when the bill is finished, it'll be introduced to move forward. But you know, this has been a long effort to get it to this point, and your state representatives need to know about it. There's a lot on their plates, right? A lot going on, but
one problem that I think I see is there isn't much incentive
Well, often, the direct care workers have many jobs. They're usually working 2 and 3 jobs to make ends meet. You know, I mean, the people I've encountered at the different communities I've been at, I mean, you know, there are some really sincere, hardworking people. You know, they want to do a good job. And, you know, this is something that we have to give them dignity, right? And it means that we have to treat them with respect. And sometimes things don't go the right way. And our family get irritated, or the resident gets irritated, and, you know, who gets blamed? Well, it's the person right in front of you. But we have to remember that that person, that may be one of their 3 jobs or 2 jobs, and just to think there's a special fund for these folks in the state, so that they can get to work if they get a nail in their tire. If they need child care, there's a special fund to help them so that they can get to work. That's how pressing it is. So let's think about how we can reward them also in our interactions.
I think we need to wrap up in a minute,
Okay.
but you could speak with just Justine afterwards. She'll stay around for a minute. I want to mention a couple of things to you. Our parish nurses who are paid to work 5 and 10 hours a week, they spend a lot more hours than that, as you know, and they have met with a lot of caregiving agencies. They interview them, they bring in their folks, they talk to geriatric care managers. They have a resource list. So if you needed somebody in your home to provide 4 hours of care twice a week, and that came up for either a short-term or a long-term situation, you know, don't just don't Google it. Call them and sit down and ask who in town would they recommend, who of our members use that they would recommend. So that's just one way your parish nurses are a resource to you, but I can't say enough about the way that they spend their time preparing to be that resource to you. I also want to mention a couple of things that you're probably aware of, but I'll say it again. Sunday is our part 2 of our palliative care and faith series. Part 1 was on Sunday. I saw many of you there. If you didn't see it, it's on the YouTube page with Dr. Joe Dixon, who's the palliative care doctor. These are the kind of issues that are relevant, as well as this, right now, that you want to be aware of. And there will be some surprises for you in listening to that presentation. Part 2 is this Sunday with a palliative care social worker, and part 3 will be with a chaplain from U of M Hospital who covers palliative and hospice and more. So these are the kinds of things we want to put in front of you. And if you can't be here in person, like this wonderful presentation, Justine, thank you for it. It is on the YouTube page for First Pres. And Bill Hall, thank you, Bill, so much for coming every time we need you. He will post the slides with the presentation within 2 days, he tells me. So TikTok, within 2 days, you'll be able to go to our YouTube page and both hear what you saw today, but also have the slides really up front for you. And then a reminder that the Ministries comes back in person a week from Thursday. We will be in this room for lunch. We will have Stephen Postema, who is the longtime city attorney, the son of Don Postema, one of many of his kids, who will be talking about his book, Running Around Ann Arbor. And if you haven't seen that book or read it, I hope you'll come and hear him and then get the book. I loved it. And I'm excited that he'll be here. So that's going to bring us back together. But first of all, Sunday. Anything else for us? Otherwise, we'll conclude with prayer. Charlie?
I strongly recommend Joe Dixon's talk.
Yeah.
I couldn't come in, but on YouTube, it is fantastic. And I also want to give kudos to Bill Hall, because the audio visual for that was superb.
Bill Hall. And that presentation came in on Saturday night at 10 o'clock to my email inbox. Joe's been working on it for a long time, but you know how this happens when it just like disappears and you thought you saved it? So I really want to give Joe all the credit in the world, and he is a great doctor. So let's conclude this time with prayer. Our precious Lord, in the season of Lent, we recognize even more our fragility, our need for you, our vulnerability, our repentance. And as we've been so blessed to have Justine here with us today, whether we're online or in person, we thank you for the ways that your Spirit is leading us to think and prepare and ask, not out of fear, but to know that knowledge is key, and our families, we and our families and others can be prepared for what is ahead, and maybe ahead soon. For some of us, we don't know it's around the corner, but we do know, Lord, that whatever is around the corner, you are there to meet us, and you will walk with us, and this church will walk with us. And so for that, we are truly grateful and give you thanks this day through Christ our Lord. Amen. There's more handouts over there if you need to take one to friend.